Hey, Kathy, remember when every injury got exactly the same prescription? I rolled my ankle.
Ice it.
I hurt my back.
Ice it.
I tore my hamstring.
Ice it.
I'm emotionally devastated.
Have you tried putting frozen peas on it? The freezer became the most qualified healthcare provider in America.
Exactly. And somewhere there is still a bag of corn that's been treating knees since 1998.
Today we're talking about why we've largely moved beyond rice, why icing isn't evil, but it's also not magic, and why the newest evidence gives us a much smarter roadmap.
It's called Peace and Love, man.
And it's not a Beatles reunion.
Yeah, this is The Pitch. What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. All right, welcome back to the Pitch Podcast. I'm Dr. Jason Young.
I'm Dr. Kathy Lynch.
At least that's what they tell us.
Mm-hmm.
And we're your co-hosts for the Pitch Podcast, which is, Kathy,
Yes.
I've done some searching, and there is really not a podcast out there that's like this.
I believe it.
Yeah, I was like, I wonder who's out there doing what we're doing. And there's other health and wellness podcasts, but they're podcasts.
I was going to let it slide.
I'm getting so old. No. But there really isn't one that is a chiropractor and a physical therapist not trying to punch each other in the nose.
Duking it out.
Yeah, and there's a difference between not trying to punch each other in the nose and tring not to punch each other in the nose. Yeah.
Yeah. And, just to toot our own horn, I think that we make it fun.
Yeah.
Like we give evidence-based information, but also we like to laugh about it.
Yeah. We're the greatest of all time. I actually, I feel like I mention this every episode, but I'm on social media.
Oh.
Yeah.
Okay.
And there was a physical therapist, and she was going off about, she had a friend of hers that came in and was like, oh yeah, I've been doing physical therapy and it just hasn't been working, blah, 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 blah. And she's like, well, let me see what the plan. She handed her the plan and she said, the name of the top was so-and-so DC. That's not a physical therapist. That's a chiropractor. And I'm so sick of chiropractors trying to cosplay as physical therapists. Blah, blah. Yeah, she went on and on and on. Apparently, she didn't know that we have a shared scope of practice.
100%.
Yeah. So, but yes, we've been reprimanded. Chiropractors, quit recommending exercises and cosplaying as physical therapists. What would I need to wear? A polo? Or
Polo and khakis.
You khakis, right? Exactly. Mm-hmm.
We're more alike than we are different.
Yeah, totally. And it's okay, and it's just fine. So, very good people in both professions.
Absolutely. Yes. And very bad people.
Yeah. And some crooks. So, yeah. Well, today's topic in the world of chiropractic and physical therapy is both very controversial, but also very much the direction that the evidence is moving. So, what have you got for us today, Kathy?
Well, peace and love. We're just here.
What about the whales? Should we save those? Should we save those whales?
Yeah.
Peace, love, save the whales, right?
That's right. I actually heard one of the first times I remember the debate on ice. I think I was at ACSM, which is American College Sports Medicine Conference. And I think it was like 2016. And they actually had people up on stage debating whether they prescribe ice for injury or not. So, but it's taken like now 10 years for it to become mainstream.
Did it devolve into a fist fight? There's people that get pretty passionate about it.
There's passionate people on both sides.
Yeah. Well, and
it's wild.
You're getting passionate about ice. Yeah. And it isn't just ice, right? Because I took first aid whenever I was a Boy Scout. And that is the extent of my medical training. That and the weekend chiropractic correspondence courses that I do via snail mail.
Oh, you got it. Yeah. You took a weekend course.
Yeah, a weekend course, right. Yeah.
These days, I think it's like a 12-hour.
Yeah. Yeah, it is. Yeah.
Right. Dr. Lily. That's what Dr. Lily told
delivered via YouTube, mostly. So, no, but for the longest time, that has been the conventional wisdom. There's rice.
Yes.
And, when I was going to school back in 2004, this was the cutting edge rice. And then there was an advancement in rice technology. So rice, of course, is rest, ice, compression, elevation. So you get an injury, that's what you're supposed to do.
Yes.
Rest it, ice it, compress it, elevate it. But then when I was in chiropractic school, they changed rice to price.
Oh, yes.
Yes. The P was not for frozen peas. It was for protect.
Frozen peas are very effective, though.
They are. They've been specifically researched.
Oh, I didn't know that.
Yes, they have.
That out?
Yeah. So there's icing, and then there is like where you could take like ice cubes or whatever. Or like a frozen steak or whatever, because that's sanitary. And then they've also studied actual frozen peas, and they found that frozen peas are actually very effective, and it's because those spherical shapes that it allows them to contour to tissue more. Yes. It's like somebody literally is out there with a PhD
studying this.
Yeah. Who? What's a brand of frozen pea? Orida? Do they?
Yeah. Probably.
Yeah.
Why not?
Yeah. They've got
Green Giant.
Green Giant. Yeah. They Green Giant funded their PhD. It's like you can't trust that science. It's biased. Okay. Big vegetable paid for that.
So frozen corn wouldn't be quite as effective because it's not spherical.
Spherical? Who came up with that stupid word? Man. Like, why do they hate people with lisps? And why does the word lisp have an S in it right before a P? That's cruel. Anyway. But yeah, maybe corn. Yeah. I don't know. But yeah, it's so it's a rough world out there in the world of vegetables versus physical therapy. So so that's kind of, I guess, the milieu or the background, the environment in which this big change to peace and love existed. And you have some hardcore rice pricers.
Oh man.
And then you have a bunch of long-haired peace and love hippies.
Yes.
Who have evidence on their side. So break it down for us.
Yeah. So, in researching this topic, rice was first coined by Dr. Gabe Merkin in 1978 for the sports medicine book.
The sports medicine book.
It's in italics here, so that means it was the book.
Yeah, that was the book back then, before the internet.
It became the default first aid advice for soft tissue injuries. So there you go. However, in 2015, Dr. Merkin himself walked it back.
Oh, walk it back. Walk it back, Merkin. Walk it back.
That's right. He said writing that both ice and complete rest could actually delay healing.
Ah, dang it, Merkin. What have you done? What have you done?
Yeah. So, well, first let's define what peace and love means, but then let's go back and I think we should talk about what ice does.
Yeah, because sorry, and I think you're focusing on the ice because that's really the biggest change, right? The other stuff is kind of still in there, and love is actually the special ingredient.
It is.
In this. All right. Well, okay. P. What does P stand
for?
Protection. The same P as in price. Yeah.
Yes.
So
we agree on that.
Definitely. And so what do we mean by protection? So it's like once you've injured something, protect it.
Protect it.
Yeah.
And I think today we're mostly going to be talking about soft tissue injuries. Like if your bone is sticking out of your leg, ice it. Actually, go to the hospital.
Yeah. Get to the hospital. Immediately, get to the hospital.
Go to the hospital. So today, and this is your friendly reminder. This is not education. This is purely entertainment.
Yes,
not medical advice.
Yes, none of this makes sense. Right.
Anyway, we're going to be talking about mostly soft tissue injuries. So protect it, which means, if it is a sprain, a knee sprain, ankle sprain, elbow sprain, protect it. That means, if you sprained your elbow, don't go out and play, tennis. for 12 more hours, or pickleball. Yeah.
Yes. Or pickle tennis.
Yeah.
Right.
Exactly.
Yeah. And so sometimes that means you're taking yourself out of a sport and not exposing it to other opportunities to get injured. Sometimes it also means get that body part away from other people who are moving around. Like, gosh, the number of times, like if you watch college sports, for example, you'll see that there's a pretty good amount of time where like guys will have like a teammate sit down on their rolled ankle or like they get kicked or like a ball or something like that. So it's not just quit playing. It's also protect it. So put it in a boot sometimes.
Put it in a boot.
Number one reason they put stuff in a boot
is for the dangerous people around them.
Yes. Yeah.
Literally.
Exactly. Right. And it's a common reason people get like those orthopedic shoes and things like that is it's just like, you're going to bang it on a doorway or somebody's going to kick it or your dog is going to, you know, so protect it.
Protect it.
That's P. What about E?
Elevation. Still in there.
It is.
Still in there. Has not been proven, you know, old science. So we're still elevating.
And this is like a Superman thing. The closer you can get it to the sun, like it improves its chances of recharging or. I
mean, ideally you try to get that limb or injury above the heart so that it drains. It doesn't pool up, down either at the bottom of your foot or below. Yeah. Yeah.
So important physiological fact. The heart only pumps blood through the arteries. And then once it gets through the arteries take blood away from the heart and it gets into the venous system. All those veins are moving stuff through via muscle contractions or gravity. And so when you elevate something, you're allowing all that blood to kind of flow back to your heart. And it's not that there's blood that's pooling in your limbs, but it's the lymphatic system around there too, which are like little wispy vessels. That's where the swelling and everything comes from. That follows your venous system. And so also muscle contractions and gravity. So if you're elevating something, you're not giving an opportunity for a whole bunch of swelling to show up in that limb. What if the trauma is your heart? You lift your heart above your heart. Yeah. No.
Is it above your brain? Or?
That's a get to the hospital.
That is definitely get to the hospital.
Yeah. I don't know if we'll ever put an S in that word again.
Why would we?
Yeah. We've changed the lexicon. Yeah. All 300 people watching the pitch are going to, which is like 400 more people than we had our first year.
Absolutely.
Yeah. They are going to change the world. All right, so that's E.
And this one is controversial, sort of. That was E. Now we're on to A. Avoid anti-inflammatories. This is a big switch.
Okay, that sounds like a real stretch. A. Avoid anti-inflammatories.
We are stretching this. Avoid anti-inflammatories.
Okay, that doesn't make sense. Why would you avoid anti-inflammatories? Like, why not pop an ibuprofen or an aspirin or something?
Well, pain is not the enemy.
Okay.
And neither is inflammation. Okay. I think this is the part where you have to do a mind switch in that, we used to think inflammation was bad, and really inflammation is the body working to heal that specific spot.
Yeah, but it can get out of control.
Yes.
Which inflammation getting out of control is bad.
Yes.
But if you don't have inflammation, you're going to die.
That's right.
You are. It's an important part of
100%.
It's actually part of our immune system is what it is. So you can't fight off infections. You can't repair tissues. It is like the construction crew, the wrecking crew for any time there's something wrong in the body.
Yes, you definitely need some inflammation. So yeah, I've definitely had surgeons, physicians tell their patients, when they come to see me, oh yeah, my doctor told me I can't take any ibuprofen, can't take any NSAIDs because they want the swelling to continue. So
yeah. Oh, and that's an interesting thing about swelling too, is sometimes swelling isn't all bad because swelling kind of creates a natural splint around parts too.
Yeah.
I don't know if that's what the body's actually trying to do, but that's the effect. And, we've mentioned before shockwave therapy.
Yeah.
And for example, with shockwave, it induces like kind of a controlled inflammation. And if you're taking an anti-inflammatory, so like ibuprofen, aspirin, Aleve, Excedrin, those kinds of things, it stops those healing processes that happen associated with inflammation. So I do shockwave with people. I tell them, hey, next 72 hours, you're going to have to be off of your prednisone or your NSAIDs and things like that. So yeah, avoid. So we have protect. This is a P. E is elevate. A, avoid anti-inflammatories. C,
compression.
Hey,
still in there.
Still in there. All right, you made the cut. Compression. Good job, man.
You're still there. So, and this is, again, could be controversial because this seems a little hypocritical because we still got compression in there, and that is meant to limit swelling. So what are we doing?
Yeah.
Do we not want swelling? I thought we just said we wanted swelling.
Well, we don't want too much swelling.
Okay.
Yeah. Because one of the things that happens when you get too much swelling is, the swelling, it takes up space. And if you can't get blood flow to an area, it can't heal. It's kind of like if you have like a house in the woods and there's an earthquake and your house falls down and catches on fire, you're going to need to rebuild that thing. But if you don't have a good road out to that house, it's going to be very difficult to rebuild it. Certainly not to the standards it was before. And so that is what you call a metaphor, Kathy.
That was a very good metaphor.
I made a metaphor on this show.
And,
okay.
Yeah, and that reminds me to shout out to one of our favorite listeners and guest, Clemmy.
Oh, Clemmy.
Yeah, Clemmy had a bridge out.
Really?
Yeah, she's got a real good story about it.
Okay.
Way back in the day.
Might be time to have her back on. Let's revisit Wonder Woman Island.
Yes.
Clemmy. Yeah.
There's no bridge.
So if you have a good road to your metaphor house, you can get raw materials there. Now, here's where the metaphor is.
Okay.
If you have an injury, if you can't get good blood flow to that injured site, you can't get the raw materials there to repair it. And so too much swelling, too much compression is going to make it so that tissue can't heal. So when we're doing compression to prevent swelling, we also have to make sure that you can still get blood flow to the area.
You do not want to choke it off.
When you're wrapping an ankle, you got to check those toesies.
Yes. We don't want blue toes.
No, if they're blue or they're black and you're not naturally black like me, I don't know what you brothers be doing when it's time to wrap the ankles. No, but even brown people have capillary refill on the toes. Yeah, so
check it.
You do not want to make a zombie foot or wrist or hand or anything like that. So compress, but not too much.
Compress, yeah. All right, the last E in peace, education.
So read a nice book.
That's right.
Google something.
Go read a book on how to build a house.
Yeah.
This part of it, you could kind of make whatever you want it to be, but the originators of peace and love want clinicians to educate the patient about their situation, their injury. So, for example, we don't necessarily need to go to the hospital for ankle sprain.
Right.
We're going to protect it. We're going to elevate it. We're not going to ice too much. And then we'll get back in the next section. We'll talk about loading it. So,
before we do, let's talk about that ankle example.
Yeah.
Like, I know that there's certain groups of people who, when they have an injury, we're not just all the peace stuff is good, but there's sometimes when we're going to want to kind of escalate that a little quicker. You already brought up a bone sticking out. Yes. But there's the Ottawa ankle rules where if you're over a certain age and you have like an ankle injury, we're going to x-ray it. Right. Or if you've had a fall, we're going to x-ray it. If you have a juvenile that's coming in and they're limping or they have hip pain and they don't have like an injury, we're going to x-ray it, right? So there's some of these things that we escalate a little quicker just because they make something called clinical prediction rules. And clinical prediction rules is when they take a whole bunch of cases and they look at them together and they're like, what are the common features of this? And can we make a rule that's going to help us to predict when something that is unexpected or a little more dangerous happens? And so like the Ottawa ankle rules, for example, that's a clinical prediction rule that helps us to prevent telling somebody, hey, peace and love, walk it off, you're going to get better, when really they might have a fracture and they need a surgery or something like that. So this is a good time to layer on another disclaimer, which is it is a good idea to check in with your medical professional and make sure that your situation kind of fits what we're talking about here. Don't just take our word for it and say, oh, peace and love. Yeah. But if you feel like yours might be a little bit outside the box or it's not really responding to this, definitely check in with your healthcare provider.
For sure.
Unless it's a podiatrist. Okay.
Not the healthcare provider.
Come on. No, I'm just kidding. I'm just trying to pick a fight with somebody. I can't do physical therapy.
No.
Take that, podiatrist.
We love podiatrists.
No, okay. All right.
We're on to the love part.
The love part, yes. After I just did finger guns. All right. What does the L in love stand for?
My favorite part. Load.
Gradually, load.
Yes. Gradually reintroduce mechanical stress once pain allows.
Okay.
Movement helps the tissue remodel and regain strength. This is kind of like when we talked before, how we used to tell people when they had back pain to rest for 2 weeks. Same idea. Too much rest is not good.
Yeah.
So protect it, right? First 24, 48 hours. Elevate, compress, all the things. And then when you can move and load that limb, get to it.
Yeah.
That's what I'm trying to say.
Yeah.
Load it. But, usually what I tell my patients, anything less than a 4 out of 10 is probably okay to load.
Yeah. Yeah. Well, and, it's kind of funny because I was having this conversation probably a couple weeks ago with somebody, and they're like, so why do they say that? And I was thinking about it, and I was like, well, the reason they say that is because the people who do early loading get better outcomes.
They do.
Right? And it's like, do we need to look for a physiological reason or exactly what's happening? We could, and I'm sure there is one. But the fact is that people who are loading early and appropriately get better outcomes, right? You're going to get better range of motion, quicker return to full strength, quicker return to your normal activities, and you're going to avoid maybe one of the most dangerous things about any of these types of injuries, which is you or yourself disabling yourself, right? So when your doctor's like, oh, you can't ever run again because if you run again, you might sprain your ankle again. Right?
We don't want that.
Yeah.
You did it once.
Yeah. I guess you're done lifting weights, sir. Because you lifted that weight and it gave you an owie once. And do you want another owie? Because that's how you get another out. No. It's like then people start getting in their head, I can't.
Because of blah, blah, blah.
Yes. Yeah. And it's so that is disabling yourself. You were like, I have a disability now. I cannot do this. And that's not true.
Right.
It's often not true. So early loading not only helps you get whatever magic happens with early loading, it also gives you some confidence in using that tissue again. So
yeah, studies definitely show people who load early have better outcomes. But the sciencey part of it is that mechanical stress actually does starts a cascade at the cellular level to heal those tissues. So, yeah.
Yeah. So is O for outcomes then?
This is where we get woo-woo.
Yes.
O stands for optimism.
I love it. No, it's really good. This is my favorite one.
This is your favorite? Okay.
It's so appropriate that it's in the love part.
Tell me more
right?
about it then.
Oh, how you think about an injury really determines what your path is going to be. There's not a lot of people that are just like really, really negative about an injury that they get. And then they're just really, really surprised when all of a sudden I can do it. I suddenly have all this confidence in my abilities, and now I'm doing it. No, if you're really, really negative about an injury, you're going to have a worse outcome.
That too. If you're pessimistic, you will not be making no money.
I wonder, do I need caffeine at this point? I might have money on the mind. Yeah. So you're going to get a worse outcome for sure. Your income could be pretty good, though. Who knows? So, yeah, you got to, believe in yourself. Have a little faith.
Yes.
This is sometime we're going to have to do like a whole episode on motivational interviewing and cognitive-based therapy. Those are some of my favorite things to use in practice. And a lot of it is just kind of helping people through the process of how are you thinking about your injuries and your health? How are your emotions around it? And how does that impact your behaviors?
Yeah.
And so, stay tuned.
Stay tuned, future guest.
For not this episode.
All right, V.
Vigilance. Oh, sorry. Vinegar?
No.
Apple cider vinegar.
No. No. Vascularization.
Yes. Vascularization.
That was hard to say.
Yes.
Cardiovascular light aerobic exercise early on to boost blood flow to the injury site. Oh. Here we go again.
Gotta rebuild the road to the cabin.
Yes, we need the flow.
If it has blood, it can heal.
Yes.
Unless, you can't. I said that. And then I started thinking about all the exceptions. No, gunshot wound. You want less blood flow to that.
And then there's certain times.
Strange sprain, though. Yeah, let's get some blood flow to it. Yeah.
We don't want extra blood on the brain. We want some blood on the brain, but not extra.
An appropriate load.
Yes. Everything in moderation.
Yes. Please.
Blood flow in moderation, everybody.
Yeah. Tourniquets never saved anybody.
These last oh man. Okay, these last two they're very similar. So E is for exercise.
Exercise. Do you get the sense that they were just like, who
wrote this?
Love would be good.
Yes.
Let's see. We really mean load.
Yeah.
But what are some other letters like? Oh, optimism.
Yes.
And then
vascularization.
Yeah, and extra optimism. No, exercise. Yes, which means load and vascularization. Yeah, but hey, good job. We knew what you meant.
This sure sounds like a PT wrote what peace and love is about. And what?
Come on, don't go hard on PTs like that. Oh, they did? Never mind.
Blaise Dubose. In fact, I think I've listened to him talk. And then Jean-Francis Esculaire.
Jean-Francis.
They wrote an editorial in the British Journal of Sports Medicine. Soft tissue injuries simply need peace and love. And that was back pre-COVID, when we still had all our brain cells.
Yes, back before anybody needed to understand logarithmic math. Yeah.
Yeah, so I've been hearing more and more healthcare providers talk about peace and love. And actually, shout out to my Helix crew. We were on the group text. We were talking about peace and love when it came to injuries, and so it's starting to get more mainstream now. But I don't really love the hate that ice is getting.
Yeah, well, Can I just say, though, that whenever I come across somebody who needs peace and love, I just refer them straight to physical therapy. I don't have time for it. I don't want to cosplay as a physical therapist. You know, I have my letters after my name. You have your letters after your name. You guys can have all the peace and love. I'm just going to keep selling crack.
Oh, my gosh.
Yeah.
I always send people looking for crack over to Body of Health.
Oh, we got the crack.
We got
some crack. And if you want some peace and love, you should go to Encore Physical Therapy. PT, so good. So good. You're going to want more.
More love, more peace.
Yes. Man, I'm having a hard time with the words today. Yeah. PC, so good. You're going to want
more.
Pasta. Okay. So rice, tell me about, you were implying that maybe we've been a little hard on rice. Yeah. In particular, the I in rice. There is an I.
There is an I in rice.
Yeah.
Yeah.
Roll the credits.
And maybe, and maybe I'm just being so old school. I just don't want to let go of what I learned to rice it.
Yeah. Well, 1978 to 2015. That's how long that recommendation stood.
Yeah.
And so just thinking about logically, are we saying that there was roughly 40 years of no benefit from using ice for anything ever?
Exactly.
Yeah. And not the case.
No.
Not the case. So there is value in using ice as a treatment. But just like anything else, we got to use it in the right dosage and at the right time, right?
Yeah. So what does ice do, right? Well, in theory, it cools the area, constricts the blood vessels, cutting off blood flow to the area to reduce the swelling.
Yeah. And it also reduces pain.
Yes.
So those are valuable things.
It's important.
Right?
It's important.
And there are times when you do want to control or even stop inflammation.
Yeah.
And so ice can be a very good thing for that. Let me ask you this. What do you think about the ice baths?
Yeah.
Yeah.
Well, research shows really that those aren't as effective as they once thought they were in recovery.
Yeah. And you know, it's one of these things where once somebody starts making money off of something, the list of things that it treats grows too big.
Yes.
Said the chiropractor. Okay. said the chiropractor, right? But I mean, we see that all the time with stuff. It's like, oh my gosh, colloidal silver. Oh, geez, it's got antimicrobial properties. Oh, well, then of course it also treats this and this and this. You know, and I think that that's what kind of happened was like with ice baths in particular. It's like, oh man, if you jump in the ice bath, you're gonna grow taller, and you know, and your breath won't stink, and you know, and it's just like, no, just be realistic. It can feel good after you've run for a long time.
Absolutely.
Yeah. So yeah, I think some of those things get kind of out of control. But back to like just regular ice, I mean, what are some situations where you would recommend somebody use ice?
Going back to the knee, my favorite joint in the body. One of the things we want to do is after someone has a knee surgery is quiet the knee, they call it.
Yeah.
You want a quiet knee. And so that means getting the inflammation out of there as quickly as we can, because inflammation inhibits the quad.
Yeah.
And we need that quad back as soon as possible. So definitely recommend ice when it comes to the knee, a knee injury, total knee replacement. I mean, that is one of the most painful surgeries, is getting your knee replaced. And so like those people need as much pain relief as they can get without having to take another pill. Yeah. So I recommend ice for them too.
Yeah. Good for trauma.
Yeah.
Right?
Yes.
So, you know, any sort of uncontrolled bleeding, for example, burns. Ice is great for burns.
Yeah.
Strange how that would work, right? And there are some times when you want to slow down metabolic activities. So I do know that there's some, heart attack treatments where they will submerge people in ice. I don't know that that's that popular anymore, but there's a number of like good kind of health hacks that you can use ice for. And so definitely is still, and realistic. So like if you have an ankle sprain, right? In the beginning, you could put some ice on there, right? Especially if it just happened in the game.
Yes.
It's and you know that you're going to be out for the rest of the time. Yeah, you can put a little bit of ice on there, and you're not ruining your recovery.
No,
you're helping with the pain. You're decreasing the swelling.
Yeah,
and also the other thing about ice is it's a great signal to your teammates to don't sit on that person's ankle when they have it propped up on the bench.
That's right.
Right. So, it's not like ice is evil. It's just not a treatment that we want to lean on or rely on for recovery because it doesn't have healing properties.
That's right. And the other thing we have to, going back to peace and love, this is not a researched science proven by a peer-reviewed randomized controlled trial. This was an editorial written by some physiotherapists
one day
who are smart.
Yeah.
And this is a good approach to it.
Yeah.
But they actually did some studies. There's not a lot of research on it, but they did do some studies.
I mean, one day our successors are going to be doing an episode about how peace and love is crap.
Yes.
hey, it's based on an editorial that some physical therapist wrote. Yeah.
Exactly. Yeah, and there was a study that they compared rice versus peace and love, and people had the same outcomes. To be honest.
What?
I know.
Yeah.
I know. So I love the idea, but I also am not going to swear off ice with my patients.
Yeah.
So you just remember what are we using it for, right? What are we using ice for? And I think a couple of reasons. I think you kind of touched on it too. Like also ice, when you put it on somebody who's had an injury, can help calm them down. Right?
Yeah.
And they're like, okay, you're healing now. You
got a little bit of a placebo effect.
Yeah.
Yes.
You got ice on it now. You're going to be okay.
Yeah.
And so sometimes they just need that for their nervous system too.
Or is that what Big Vegetable wants you to think?
Green Giant says put some peas on it.
Oh, you put ice on that? Should have put peas on it. Yeah.
You're never going to walk again.
Oh. Oh, goodness.
Yeah.
Yeah. But you remember like the 80s and 90s where the only job that an athletic trainer had was to find creative ways to just strap ice to every single limb and joint that a person had. Like maybe individually wrap an ice cube to each finger. Like if you could, that's a really great athletic trainer. It's fun to see how far we've come.
Exactly. Yeah.
So, but speaking of like the ice baths and stuff like that, just wanted to give a quick shout out to my mentor, the guy that I did my preceptorship with, Dr. Will, Will Harden, and he was a big cyclist. He tried to get me into it. He didn't understand how futile that was. I ain't getting on a bike, homie. Nope. So, but man, his girlfriend at the time, I think she was like, she was doing like a master's or a PhD down in Arizona. But man, he was a big advocate of, hey, after you go and you do this big, long, 100-mile bike ride, get in a garbage can full of ice and water. He's like, and boom, you're ready to go.
Back in the day.
And the guy was in great shape.
Wow, yeah.
He was in great shape. When you say back in the day like that, and you make it sound like
back in the day,
I was an intern like
65. He was ahead of his time.
Yeah, there's a lot of really good athletes out there that, they've used the ice technology. So, but I think that scientifically, all the principles that we shared in peace and love are sound, if not a little redundant sometimes.
Yes. Yes.
Oh, goodness. What else you got? I
think it might be game time.
It's game time.
Yeah.
All right. Well, let's see here. For this game, let me get to my game screen here. PTCH peace and love. What an interesting acronym. Okay. So we're going to play a game of acronyms.
Okay.
Yes. I have a list of acronyms, and I need you to tell me, are these real acronyms?
Oh, boy.
Or are they fake acronyms?
Okay.
And what I'm going to do, I'll read the acronym, and then I'm going to read what it stands for. And you have to identify the real ones and the fake ones.
Okay.
You got it?
Yeah.
Any questions about the format before we begin?
So I have to identify the real from the fake.
From the fake, yes. Okay.
Do that.
All right. Let's go. Number 1, grip. Stands for guarding, recovery, immobilization, and protection.
That's real.
That is fake.
That is fake.
It's manufactured. Okay. What about fit? Frequency, intensity, time, and type.
That one's real.
That is real.
Yeah.
Good job, physical therapist. Yes, definitely. What about trust, traction, rest, ultrasound, stretch, time? I tried to do it with a straight face, Kathy.
As a physical therapist, I endorse that as real treatment.
By which she means, yeah, that's fake.
Fake.
Was it the ultrasound?
Yeah.
Okay, how about this one? Calm, compression, alignment, load, mobility.
Fake.
Yeah, that's just so weird. It's like those things don't even work. Like, what are you treating? No, it's the alignment. It's like, oh, a chiropractor came up with that. Okay. All right. You want a really easy one? Soap. Did I give you hives when I said that?
Yeah.
Subjective, objective, assessment, plan.
Unfortunately, that is real.
That is real. Yeah, that's the format for all
demise.
the chart notes. Okay. How about this one? Heal, hydration, exercise, alignment, load.
I think that's code for fake.
We're going to fix your alignment. Okay, 2 more. Mend, mobility, elevation, nutrition, duration. Why are you laughing? All right, last one. Police.
Oh.
Protection, optimal loading, ice, compression, elevation.
That is real.
That is real. Yes, it is the main competitor to peace and love right now.
It is.
The police.
Yeah.
I wonder who's going to win. Yeah.
Police, ice, peace and love.
Yeah. They left in, I mean, they subbed out rest for optimal loading. Mm-hmm. So not creative. I mean, it literally is price, but they threw in optimal loading. So, okay. Well, take homes.
That was good. Take homes. Peace and love is a great acronym. I love that it is kind of getting out to the mainstream a little bit more. However, this is not based on science, technically. This is written as an editorial. So,
okay. And I think for me, the biggest take home in the advancement that peace and love is, nothing wrong with price. You can still do that, and people are going to live.
Yep.
Okay. The thing I like about peace and love is that it's moving just from procedures and actions and a checklist to principles, for a long-term recovery, not just making it to the end of the basketball game. Mm-hmm. So, yeah. Any shout outs?
Jay Bliss?
Yeah, Jay Bliss. We're getting so much mileage out of that episode. Love it.
I mean, we're multinational now.
We are. Yes. She's introducing us to people in other countries.
Yeah.
Other continents.
Yes.
Mm-hmm. So
grateful for that.
Guten Tag to our listeners. Yes. I don't think any of it was Germany, though. Yeah, she made a list. Shout out to sponsors, Encore Physical Therapy, PT, not PC. So good, you're going to want more. Mm-hmm. There's Body of Health Chiropractic and Wellness Center here in Corvallis. Voted the Willamette Valley best chiropractor in Willamette Living Magazine or something like that.
Encore came in second.
Oh gosh,
first loser.
We're gonna get you guys. We're gonna get you guys
next year.
Next year. You guys just need to work a little harder. And then, of course, the best podcasting studio,
absolutely,
in the area. Titan podcasting.
Yes.
So thank you very much. And I think there's just one more little tidbit to get to, and that's there's no I in pitch.